Hello again. So we talked about asthma a couple of videos ago, then I went into God and law of karma. This one is a continuation of asthma. So in this particular video, I'm going to talk about how to monitor and what are the extra drugs that may have been added to the armamentarium of the physicians to treat the asthma. One of the drugs which has been there for a long time is a medicine which is designated acting as LAMA. If you remember my statement that God has given us both types of chemicals in our body. For example, we have insulin, which decreases the sugar, and we have glucagon, which increases the sugar. We have every drug or every chemical that has opposing effect, so as to say yin and yang, or good and a bad, but it's actually not good and bad. So there are adrenergic drugs. The adrenaline is the chemical that is secreted through adrenal gland, and these stimulate to increase the heart rate, increase the blood pressure, and open up the bronchial tubes. So adrenergic drugs are used to improve the asthma attack by doing bronchodilation, opening up the bronchial tubes. So there is another system in the body which is called parasympathetic system. Sympathetic system is the adrenergic system. The parasympathetic system is cholinergic system. So when you stimulate the parasympathetic system, it will cause bronchoconstriction, narrowing of the bronchial tubes. So adrenergic system or sympathetic system will open up the bronchial tube or cause bronchodilation. Parasympathetic system or cholinergic system will cause bronchoconstriction. So people have come out with drugs that block the parasympathetic agents, and that will cause bronchodilation because there is a balance between the two systems in the body. I used to give an example of having a improvement in your bank balance. So if you want to improve your bank balance, you have to make more money or spend less. So sympathetic system could be considered, which is adrenergic, as making more money or making more chemical available to improve the bronchodilation. And parasympathetic system blockage could be considered as reducing the expenses. So the combination of these two will have an additive effect because both systems or the chemicals are independent of one another. So people have come out with drugs which are parasympathetic blocker for the bronchial tubes. And these include the drug which is used in the inhaler form called ipratropium or Atrovent, which is an old drug, probably 15 years old or maybe 20. And the same drug was also used in a nebulizer form where you put it as a liquid into a vaporizer and inhale it 3 or 4 times a day. After a while, people came out with the longer acting drugs. So parasympathetic system blockers, ipratropium, they came out with a longer acting drug which was called tiotropium, was the first one. It was called Spiriva. There are other drugs which are also on the market, and instead of telling you the chemical names, I'm going to tell you the brand names because most of the people, physicians included, know these drugs by their brand names. So sometimes we can combine sympathetic stimulator with parasympathetic blocker. So the drugs that are there available as single drug in form of LAMA, long-acting muscarinic receptor, or the blockers of parasympathetic system are Spiriva, Spiriva. It used to come as a capsule that you break and inhale with a handy heller. It is now available as something called Respimat, which is like a nice jet, nice flow jet that you can use it. And both these medications are done once a day. And combining this drug with the other drugs that I mentioned to you, which include inhaled corticosteroids and long-acting beta agonists or LABA, has been available now or approved by the FDA for asthma treatment. So you could combine either Advair, Breo, Symbicort, or Dulera with Spiriva in a severe case of asthma. There are other drugs which are similar to Spiriva. They all not have been studied with asthma as such, but the mechanism of action is similar and certainly would be effective. So the drug companies or the FDA has not stated that they should be or could be used with asthma, but a lot of physicians off-label do use them. One of them is called Tudorza. Tudorza is another parasympathetic blocker, and it comes with an inhaler which has a strip, and it is breath activated. So when you take a breath in, you hear a click, the medication is released, so you don't need to coordinate your breath and pressing of an inhaler like it needs to be done with something like Dulera or something like Symbicort. So Tudorza is that way used. It's one puff twice a day. A third drug, which is available also nowadays, is called Incruce, I-N-C-R-U-A-C. It's another drug which is parasympathetic blocker. It is used as a disc, which is a dry powder inhaler. It's used as one puff once a day. So the advantage is it is only once a day. The advantage, if you consider dry powder as an advantage, is once a day dry powder. So we have these drugs, the Spiriva, the Tudorza, the Incruce, and the tiotropium is the long-acting name of Spiriva. And these drugs are also available for a combination of the systems. So unfortunately with asthma, because the primary problem is inflammation, which leads to irritability, you have to combine inhaled corticosteroids with any other drugs. The drug combination which are available for asthma are, as mentioned before, but then individual drug can be combined. Now, there are people that do not want steroid, cannot tolerate steroids, absolutely hate steroids. You could consider using a drug like Singular or Montelukast, which is generic, in combination with LABA and LAMA. These are available, but they are not, I'm underlining this, they are not approved for use in asthma exclusively. So if you find these drugs, please consult your physician before you try them, because inflammation must be treated at least as of today, 2020. I'm sure in the future we might know that LABA-LABA combination, which is commonly used for COPD, might be equally effective for treating asthma, but at least not today. So there is a drug called Trilogy. Trilogy has three drugs: inhaled corticosteroids, long-acting beta agonist, and long-acting parasympathetic blocker. Again, the FDA has approved it for use in COPD, not in asthma. But if you're going to combine inhaled corticosteroids and LABA with a independent LAMA, which is Spiriva, Tudorza, or Incruce, you might as well consider using this drug. Again, this will be off-label. Unfortunately, as of today, you have to use inhaled corticosteroid unless patient refuses it. The beauty of these drugs is they are equally effective. The beauty of this drug is most of the asthma can be controlled. How do you know if your asthma is controlled? You can buy what is called a peak flow meter. This measures the peak flow, P-E-A-K, flow of your bronchial tube's exhalation. And if you buy it, they will give you a normal value for your age, height, and sex. As males have higher flow than females, older people have less flow than younger people, and taller people have a higher flow than the shorter people. So if you buy a peak flow meter and chart your peak flow every day, you can see whether you are progressing in the right direction, wrong direction, or if you are having a bad attack of asthma and you need to call physician. There is a green zone, red zone, and a yellow zone, and more about it next time. Thank you for watching. I hope you like it and subscribe. Have a nice day.